Hi everybody, it's me, Dr. Q. Today we're going to be doing a surgery on one of our rescue horses, an off-track thoroughbred named Emblaze. A couple of weeks ago, we actually noticed that she had a big bump on her face, which I thought maybe she just, bumped into a feed bunker or something like that and gave it a few days to see if it would go down. Unfortunately, it's not going down, so it's staying the same, and I'll show you here a close-up in just a moment, and then you can see what her face looks like. And so we're going to get in there surgically today and try to figure out what that is and let that swelling hopefully go down. What I have here on the table is everything that we need to go ahead and get started with that. I have sedation for her. I have a lidocaine local block. We're going to draw blood on her because we might as well, so that we can take that back to the lab and do CBC. This is pain meds for later. Here's a little histopath jar for if I think it's a tumor, we think it needs to be sent out. My surgical pack, scrub, suture, Banamine for her for pain, antibiotic injection, and then again, since we are going to be having her sedated anyway, it's a great time to just go ahead and do her teeth. So after we get the surgery done, we'll probably resedate her a little bit. And then of course I have her medical record here so I can document all the medications that I'm using. But come on over here and let's take a close-up look at her face. All right, girl. So what I want you to notice is that, so she has this big bump right here, good girl. She also has swelling that comes all the way down here and across here. So you can see that there's swelling here. And that also has not gone down over the last few days here that I've been watching this. So it's time to go ahead and do some treatment on that and help her out. So what we're gonna do first is a quick physical exam. And I've done her exam before, but the main thing I wanna do is just listen to her heart. One second here. Okay, so I'm going to check her gums, make sure that they're nice and pink, and press and see how quickly the color comes back. I know, girl. Perfect, good girl. Okay, so she's ready for me to sedate. So what we're going to do, a little bit of alcohol here. Yeah, girl. I'm using a combination of dormosidane and torpegesic. Now she's going to get sleepy. So this is important for the holder to be really careful, because pretty soon she's going to start bobbing her head. She might even buckle her knees, and so we want to be really careful from this point out, which is why I'm having our assistant wear a helmet. So we've waited about 3 minutes, and in that time you can see she's really started to drop her head. She's buckling a little bit, so I'm going to go ahead and start shaving her face and seeing if she'll let me do that. So I don't want just hand it, so that she prompts up she doesn't. Oh, she's good. Oh, good. Can I put the lingers over her mouth? You mean what? Can I put the lingers over her mouth? Yes. You're not ready yet? Oh. Good girl. Good. Good girl. Nice. Okay, so I'm going to scrub it a little bit. It's going to be a little bit cold. Nice and easy. Nice and easy. Nice and easy. You good, Bruce. You got this. Do not. You're so good. You're so good. She's a little cold. Okay, I'm just making sure you're okay. You girl. Good girl. I didn't see you got the hang of it now. You got the hang of it. You're so good. It's good. So good. A little bit more cold. A little bit more cold. Coming in just a sec. Nothing too much. Just a little bit more cold. Nice cold. Cold. Good. Good. See? No big deal. No big deal. Good girl. So now what I'm going to do is I'm going to go ahead and get a little blood. Okay, and we're going to put it in these tubes over here. Because we might as well go ahead and get some blood on her while we've got her. We'll take that back to the lab and get those results back later. So I drew a little bit of blood now. I'm going to also go ahead and give her some pain medication. There's some Banamine. That will help my sedation drugs last longer. She'll have pain meds on board. So that's that. And the next thing I'm going to do is I'm going to go ahead and attempt to aspirate whatever this thing is on her face and see what happens, if I even can. It's pretty firm to the touch, so I don't know if a needle will even go in there, but that's what I'm going to do next. Pretty much hitting bone feels like right away. So one of the things I have been worried about is that she does have a bone fracture in her face. That certainly feels bony. So no real fluid is coming out of that. Other than a little bit of blood. Okay. So I've given her pain meds. I had drawn blood, so we can take that back to the lab. She's sedated. We've cleaned this site. Be careful that you don't touch the site with that hand. Now I'm gonna go ahead and use a local block before I open that. So she might really jump, so watch your head, okay? Good girl. Good girl. Good girl. Good girl. So what this is a little local anesthesia, kind of like when you go to the dentist and they numb you just in one spot. So I'm numbing all around here so that when I cut into this, it won't hurt her nearly as much. Good girl. Good girl. Good girl. Good girl. I'd love a little bit more light. Later there. Can I have more light, please? Really, I need that right there. You're doing so good. You're doing so good, Blazy. Good girl. Good, sweetie. tell it's still a lot of tissue there. I'm not making a lot of progress. Little baby girl.
Oh, sweetheart. Son, I love you. Love you too. Nice and easy, sweetie. You're doing so good. You're doing so good. Good boy, Oliver. Good boy. You're just touching my... I'm not.
Why don't you go back behind me and take a picture of me doing this?
Okay.
Yeah, she might really not like this. It's very difficult because the light is bad in here. First, and now that it's all sutured, watch yourself. These gaps are not necessary really for me to suture, except for it'll heal nicer if I do. So this is all cosmetic right here. Which is probably silly because her hair's gonna grow over it anyway. Any more gaps do you see?
Maybe in between the first one and the second one.
Right. I know. Last one, my love. Last one.
Sweetie.
Alexi, I need some light. I cannot see that suture. Okay, now that we're finished with surgery, I want to go ahead and do her teeth because why not? We have meds on board already. So the first thing I'm going to do is flush her mouth out. And we'll see how sleepy she is and if she needs more meds or not. Doing pretty good here, so far so good. not too bad. Now, I'm gonna go ahead, see if I can do this without giving her more med. And I'm gonna go ahead and put my speculum in. So I'll be able to do a much better job. So I'm with you. Good, I'll hold her down onto her neck, please. Speedier. Alright. We're gonna guide this into her mouth. Like this, ready? Go. Let me set this right here against her front lips, rather her front teeth. Okay. Then what we're gonna do is we're gonna guide it into her mouth. I'm gonna open her mouth right here. And we're gonna put these right between her front teeth, just like that. So I hold that right there so that her teeth are right in these little grooves, right? Top and bottom. Perfect. Stay put. And tighten that again just a little bit. Now, what I'm gonna do is open her mouth just a little bit like that. So what we're gonna do is you're gonna reach in here like this at the same time as me. Okay, but I need you to do it at the same time as me. Ready? 3, 2, 1. Open. I got mine. Good. Okay. We need to do one more thing. Right. Okay. Now we need to make a double check that her teeth are in where they're supposed to be. And I think the most important thing I would like everybody to know is watch how far I have to put my hand into her mouth to reach her back teeth. The only reason I can do this safely because the speculum. So I just got my finger around her last back molar, which is right about here. So if you have a veterinarian or anybody else come up to you and look at this tooth right here and say, oh, my horse doesn't need their teeth floated, there's no way you can know that without sedating and putting a speculum in and reaching all the way back there to feel all of those teeth. So what I'm going to do is feel for sharp points. And we don't have a whole lot of drugs left. Man, her teeth feel really pretty good. So what you just want to be careful of is make sure that that speculum doesn't come off while your hand's in there. On my file, she still hasn't clicked. It feels way better. Hard to do when they are a little bit awake still and chewing things like she is, but She's had so many drugs. Oh, look at that cat. For the face surgery. Yeah, she got some big ones. You can see that again right there. Bottom ones, they're pretty good, but we're here, so we might as well do the best we can. I'm gonna hold her tongue this time. So horses' teeth are continually growing, so they don't always wear smoothly like we'd like. So we can help them. But again, you gotta feel all the way in there. See how she's chomping. I would not want my hand in here. That's right. Just smoothing things down. Nope, she came off. So almost bit me. Yeah.
How do I
Okay, so now we're gonna go ahead and take this off. She's still got a little blood on her face. I'm gonna rinse this guy, and we're gonna put that halter on. And that's it. We're gonna put her in antibiotics. She's gonna be on pain meds for a couple of days. Those stitches are gonna come out in about 2 weeks. And we're gonna send off this tissue that we cut out of her face off to the lab and have the lab tell us if this is something dangerous or if it's just inflammation secondary to an injury. So tune in and we'll share the results with you next time. And in the meantime, say a little prayer for Blazy. We're all hoping for the best for her, that this doesn't turn out to be anything serious. Thanks for tuning in. We'll see you next time.